Welcome to the Christian Baptist Loopy Show, and first off, yes, I'm in the bathroom. Secondly, as you can see, I'm not taking a dump. I got my shorts on and everything. See, I'm not pooping. Alright, I'm just sitting. It's a good, quiet place, okay? Don't judge me. Alright, so I almost didn't do a show today, because I got hit with a pretty good headache, and I was just ready to go to bed. And now, about a couple hours after I should be in bed, I'm doing the show. So anyway, I wanted to talk about today, healthcare. So, what do I put there? Yeah, sure. So what brought this up was a Joe Biden commercial. It was a good one for him. I'll admit now, I'm not really interested in voting for him. But that was a good commercial. I got to give it to him. It was about healthcare, and he when I was first sworn in to Congress, I was at the hospital, and he gave reasons why. And then he gave other medical situations, like, I couldn't imagine not having healthcare, and that my healthcare would have, left me high and dry, blah, blah, blah. And then that was kind of his push for universal health care. But I'm not really for universal health care, and here's why. Because A, I don't want the government to be the sole source of health care. I mean, honestly, right now, my situation, I would use government health care if it was an option, and that's what I think it should be. I'm lifting my hand to show my hand movements. If I really distracted myself with the hand thing. So yeah, I'm not really for universal health care, and here's why. A, I don't want the government to be the sole source of health care, because then they have that over you. I think they should be an option, but they shouldn't be a great option, and here's why for that. Because they shouldn't be an enabler for hypochondriacs, and people are just like, I got universal health care, and they're going to take care of everything. I'm just going to go to the hospital because I got the sniffles. Oh, I scraped myself. Let me make sure that's not infected. Even though, put some hydrogen peroxide. You don't need to go to the hospital for everything. I've been to the hospital once in probably all of the 2000s. And that was because my face got exploded by a softball. That's why that scar right there and stuff. And some people need to go a little more. So what I'm thinking is, well, here's my thing with Democrats and Republicans. Democrats are like, we need to help, here's a terrible solution. And Republicans are like, that's a terrible solution. And then it's like, well, you got a better one? No, we don't have anything. Could you come up with something? Yeah. You gonna do it? Someday? At least with certain things. So, what I would propose is a government option that's easy to get. You don't have to qualify. You just, I need this. Okay, here it is. Sign this stuff. I don't know if you send them your medical issue. That's the thing. I don't have health insurance, so I don't know how much health information you got to give them. But anyway, let me give you an example of something of what the government needs to do would need to do on top of just having a government option. It would need to put regulations onto healthcare companies so they can't screw people. And I don't know all the possibilities, but one, if you've seen the movie Saw, one of them, I don't remember which one. It's like the fourth. No, it starts with this guy coming into his insurance agent, and he's like, I need heart surgery, and the guy's like, well, sorry, we're not going to give you heart surgery because you didn't mention that you had dental work or something like that. And as we all know, dental stuff can affect your heart, and so you lied, and now we're not going to give you pay for your heart surgery, and now you can go die because you didn't realize your teeth can affect your heart. Your heart's over here. So for something like that, that's either intentional, or probably usually, because a lot of people don't realize the connection between your mouth and your heart, it's just ignorance. So like something with that, you make the person pay what he would have been paying if he had shared that information, because you figure if you share that information, the rate goes up. So you come up with a solution to that where you pay the difference. That's not super simple because healthcare is sometimes you can get them to bargain with them and they'll raise and lower the price. It's like, oh, can I get you into this healthcare plan with this? So you need to have that compensation back to the company for insurance company. Like you pay them back that, you get your surgery. That would prevent fraud and protect the companies, and it protects the not employee, client. Pretty much we're clients from the insurance companies. Wow, a lot of things just popped in my head because there's a lot of things like the government covering people for everything. It enables laziness. And we'll get back to what I started mentioning at the end of the last show. People are, we don't do what we did back in the day on average. At least stereotypically. Like, you stereotypically think about the olden days, like 20 years ago, 30 years ago. Wake up, family has breakfast, and then they all go to work or school. Now it's like, come on everybody, shove that in your mouth, we gotta get going. Because we all went to bed late, and we all got up late, and we pretty much gave us just enough time to get dressed and get out the door. So maybe I'm not thinking laziness as much as discipline and responsibility. Jocko Williams has a good video on extreme responsibility. But I think it's on PragerU, so some of you guys will be like, oh, well, screw that. That's just right-wing propaganda. Even though Jocko Williams is known for not being on one side or the other. Much like me. Maybe he's... I mean, everyone's going to lean one way. No one's perfectly in the middle, probably. You'd have to list every single political issue, and somebody would have to be 50-50. And there's always going to be new political issues. But let's rewind to universal health care, because I got less than a minute and a half to go. So I don't want the government to have total control over my health care, because that's kind of scary to have the government or one thing in control of something like that. On top of that, the government isn't known for running things well all the time. Just look at the VA. So, to wrap up, I would like there to be a government option. And I would be using that right now. Don't get me wrong. Heck, I tried to sign up for Obamacare even though I wasn't for it. And they were like, yeah, even though you're unemployed, you would have to pay us this much to get health care. Or you'll have to pay this much in fines, taxes, whatever, they said. And I had a friend, same situation, unemployed. And they're like, oh, well, you don't qualify for free health care. You would have to pay this much to get health care through the government, I guess? I don't know. Anyway, this episode's running out. Comment if you have any words, and maybe I'll continue on this subject later. I probably should have done this episode with a little more sleep in last second. Anyway, subscribe, follow, turn notifications, all that stuff. Peace.